Let me see your smile. Yeah. All right. We've got Dr. Ken Randall with Tennessee River Dental joining us today. And let's talk about teeth whitening. The do's and the don'ts and the maybes. And first of all, welcome to the show.
Well, thank you. Appreciate you having me on again. It's always a pleasure to be here.
Well, I'm glad you're here because when it comes to products that are out there, first of all, okay, whitening toothpaste.
Sure.
Is it just a gimmick or does it really work?
So it's certainly a tool in the spectrum of tools that we have available to us to whiten teeth in there. But you need the right tool for the right situation. Just like you need a flathead or a Phillips head screwdriver for that particular screw, you're not going to necessarily get a Phillips head to fit in a flathead screw.
Sure. Okay.
So same kind of thing when it comes to tooth whitening. If we know what the cause of the discoloration is, then we can manage it appropriately. So whitening toothpastes are good for certain situations when we might have excess superficial stain on our teeth. Generally it's stains that we pick up from foods and drinks and that kind of stuff. The downside to the whitening toothpaste is that sometimes they can be more abrasive than general toothpaste.
So if someone with receding gum lines, it may not be the type of toothpaste you need.
Yeah, so receding gum lines, people that have issues with acid reflux that might have more acid erosion of their enamel, any situation where our enamel might be a little bit weaker, that can wear away the enamel a little bit faster and create more issues for us down the road.
That is really interesting, especially with folks that deal with acid reflux. So, okay, so we've got the products that we can get over the counter,
sure,
at the drugstore, but there are professional options when it comes to whitening someone's teeth with like a therapy regimen?
Yeah, so again, it depends on what it is that we're treating exactly, but when we have more of these internal stains, when the second layer of tooth, that dentin, is a little bit darker than we'd like it to be, that's generally when we move to more of the professional whitening products in there. Kind of two main classes of products that are on the market. Both of them are peroxide based. That's kind of the active ingredient that works to whiten teeth with a lot of our professional products in there. And so depending on sensitivity issues, depending on what our goals are, how quickly we want to get from where we are to a particular shade, that'll kind of help determine what the best treatment option is for us for people.
So you could sit down with a patient and say, okay, with this, doing this a couple of times a week, then it's going to be this white, right?
I wish it was perfectly predictable.
Okay, sure.
Different people will, based on the foods they eat while they're whitening, they might whiten a little bit better or worse. Certain people that took certain antibiotics as a child, one of them, kind of the most common one, is tetracycline. That can intrinsically stain our teeth, stain the inside of our teeth.
Yeah, right.
And whitening may not necessarily be as predictable in those kinds of situations. So if we know kind of where we are as a starting point, we can generally get a pretty good gauge of where we will likely get to. Some people it'll take longer than others just based on the way their teeth are.
But real quickly, we've got about 15 seconds left as we wrap up this and that for this afternoon. Preventative maintenance, brush and floss on a regular basis, right?
Absolutely. That's the easiest way to prevent stains, prevent cavities that can cause discoloration. That prevention, kind of like we talked about earlier today, is the name of the game.
All righty. Always some good information. Thank you, Dr. Randall, for joining us today. Tennessee River Dental. Here's where they're located: 4845 Hixson Pike, Suite C, Hixson, Tennessee, 877-3848, and TennesseeRiverDental.com for more information.